So when we talk, as I discussed in the before, there is a respiratory distress and failure. So there are a lot of other definition used in the literature: impending respiratory failure, the child is going into the respiratory failure. Friends, let me tell you, there are only two things. Either it is a respiratory distress or respiratory failure. There is no other definition of impending respiratory failure. So what is respiratory distress when we talk about clinically? So in respiratory distress, you have a tachypnea, you have a retractions, mild to moderate chest retractions. When we are talking about retractions, are we talking about subcostal retractions and intercostal retractions? The child will be irritable, anxious, and saturations. They will not able to maintain the saturation. So normal saturation in the body is more than 92 in a room air. So that is normal. And these are the kids, we are not able to maintain the saturation more than 92 in a room air. And they might sometimes not able to maintain the airway by themselves. So example is a crew where there is a swelling of the upper airway, they are not able to maintain the airway. So these are all, make sure that they are having a respiratory distress. So these are all categorization of the respiratory distress. When we talk about respiratory failure, most of them clinically have severe tachypnea. They are not like mild to moderate, severe tachypnea. They are breathing very faster. They are exhausted, bradypneic. Sometimes they are breathing very shallow, that they are actually kind of really tired out. They cannot breathe more than that. They are irritable, drowsy, less arousable, and they have a less saturation in spite of giving oxygen. And these are the patient which needs a immediate intervention in the form of bag and mask or in the form of intubation. So categorically, any child coming into emergency as a breathing issue, you can differentiate between them. It is a respiratory distress or it is a respiratory failure. Respiratory distress, as I told, mild to moderate work of breathing. They will be able to maintain the saturations. They will be a little bit drowsy and irritable, and they don't require intubations and bag and mask. But other kids who are coming in a respiratory failure, they are actually going to die unless and otherwise you intervene there. And they are really hypoxic.